Diseases of the stomach in dogs and cats. The diseases are acute gastritis, gastric erosive ulcerative disease, chronic gastritis, Helicobacter-associated gastritis, parasitic gastritis, delayed gastric emptying, gastric neoplasia, and GDV, gastric dilation volvulus. For acute gastritis, the causes can be dietary indiscretions, toxins, infections, and medications. The signs are sudden vomiting, anorexia, fever, and abdominal pain. And the treatment, you give no food for 24 hours and then antiemetics, IV fluids, and a gastrointestinal diet. For gastric erosive ulcerative disease, the predisposing factors are NSAID, corticosteroids, and metabolic diseases such as renal and liver failure and stress. The signs are vomiting, hematemesis, melena, and anorexia. The treatment is you stop the NSAIDs, you give fluids and sulcrafate. And in chronic gastritis, the types are lymphocytic, plasmacytic, eosinophilic, atrophic, and hypertrophic. The causes are Helicobacter, parasites, and allergens. And the treatments are you eliminate the causes, give a low-fat diet, and prednisolone and sulcrafate. For Helicobacter-associated gastritis, the species are Helicobacter bizarroni, Samolinosis, and Phyllis. The treatments are antibiotics such as amoxiclav and metronidazole and omeprazole. For parasitic gastritis, the parasites in dogs are Physoloptera rara. To treat this, you give Pyrentel, and in cats it's Olaulanus tricuspis, and to treat this, you give fenbendazole. For delayed gastric emptying, the causes can be obstructions like stenosis or neoplasia or motility disorders. The signs are postprandial bloating or vomiting after 8 hours, and the treatment is prokinetics or surgery if it's an obstruction. For gastric neoplasia, the tumours in dogs are adenocarcinoma, and in cats it's lymphoma. The signs are progressive weight loss, vomiting, and hematemesis. For gastric dilation volvulus, GDV, the definition is twisting of the stomach along the axis, causing obstruction and shock. The predisposing factors are large breeds, eating rapidly, and exercising after meals. The signs are bloating, dyspnea, pale mucous membranes, and collapse. And for the treatment, you need to do immediate decompression, give fluids for the shock, and do a surgery, so a gastropexy.